When William died, we didn't know what sepsis was.
So sepsis is the way the body responds to infection. So it's always triggered by an infection, like a pneumonia in William's case, but something as simple as a urine infection or a cut or a bite or a sting. But in sepsis, the body's immune system overreacts, and if we don't stop it, that starts to cause damage to the organs.
So how would I spot it?
So we all know what having an infection feels like or looks like in a child. But if something just doesn't feel quite right, and particularly if we or our loved one have never looked so ill before or never felt so ill before, we need to be prepared to ask, could it be sepsis?
And what would I do if I noticed all these symptoms in my partner or in my little boy? What would I do?
So if you're worried about sepsis, the first thing to do is to phone 111 or call your GP. But if you're really worried, you might want to look at our website to look at the symptoms. In adults, they are S for slurred speech, E for extreme pain in the muscles or joints, P for passing no urine in a day, the second S for severe breathlessness, I for it feels like you're going to die, and the final S for skin that's mottled or discoloured. And they spell the word sepsis, and those symptom cards are on our website. You'll also find the symptoms for children. And it says here, like in William's case, any child under 5 who's breathing very fast, who has a fit or a convulsion, who looks mottled or bluish or pale, has a rash that doesn't fade when you press it, that glass test rash, is very lethargic or difficult to wake, and that's surprisingly common, or feels really cold to the touch, then again they might have sepsis. And if any one of these symptoms occurs in an adult or a child, it's 999 or go straight to A&E.
And how quickly can it be treated?
If we treat sepsis quickly within the first hour of presentation, the chance of survival is really very good. For every hour we wait, the risk of dying goes up by nearly 8%, so it's an emergency.